Hello, and thanks so much for being here today. I'm excited to share an inside look at early intervention for me, Maine's early intervention program. Today, I'll share who we are, what we do, how we support families, and most importantly, how you can help connect families with us and how we can best collaborate together around the families we support. To understand how early intervention works, it helps to start with the law that guides it. IDEA, the Individuals with Disabilities Education Act, is the federal law that ensures children with disabilities receive the supports they need to learn, grow, and reach their potential. Those supports must be provided in the child's natural environment, which research shows is where young children learn best. IDEA has two parts that apply to different age groups. Part C serves infants and toddlers from birth to age 3. It provides early intervention services within a child's everyday routines, at home, in their childcare, or out in the community. The goal is to help the family support their child's development during this critical window of growth. Part B of the law serves children ages 3 through 21. It provides special education in the school environment through an individualized education program. In short, Part C supports infants and toddlers and their families, and Part B continues that support once children enter the school system. And as medical providers, you're often the first to spot developmental concerns. So your referrals truly help us reach children early when intervention has the greatest impact. Early intervention supports infants and toddlers who have developmental delays or conditions that put them at risk. Our work focuses on strengthening the child's development and building the family's ability to support that development throughout daily life. Services happen where children naturally spend their time, so learning becomes part of their everyday routines. Each family's individual family service plan, or IFSP, is individualized to their priorities and daily life, helping the child develop foundational skills for preschool and beyond. The journey into early intervention always begins with a referral, and most often that referral comes from medical providers like you. You remain our largest referral source, followed by childcare programs, Department of Health and Human Services, and parents. Once a referral comes in, we complete a developmental evaluation. Eligibility is based either on the level of delay or on the presence of an established condition that puts the child at high risk for developmental delays. We have a list of more than 300 qualifying conditions on our website, and families or providers can reference it at any time. If a child does not qualify, we don't simply close the case. We stay connected through follow-up calls every few months, and we help link families to community resources when appropriate. If a child is eligible, we partner with the family to create an IFSP rooted in their strengths, routines, and goals. Intervention focuses on embedded strategies and caregiver coaching with ongoing assessment built in so we can adjust as the child grows. And importantly, all early intervention services are provided at no cost to families. Here you'll see the 7 key principles that guide all of the work in early intervention. These principles come from decades of research and best practice, and they ensure that our approach is family-centered, individualized, and grounded in the child's real daily life. I highlight these today because they often help explain why early intervention looks different from a traditional clinic-based therapy model. Instead of working on isolated skills during brief sessions, we focus on building the child's ability to participate meaningfully in the routines and activities that make up their day: mealtime, playing, getting dressed, going out into the community, and so on. At the heart of these principles are a few core ideas. Infants and toddlers learn best through everyday experiences and interactions. Families are the most consistent and influential adults in a child's young life. Interventions should build on family strengths, priorities, and real routines. And strategies must be evidence-based and functionally meaningful to create lasting change. When these principles are put into practice, families become confident partners in their child's development, and progress happens naturally within the flow of daily life. To put these principles into action, Maine uses an evidence-based model called routines-based early intervention. This model helps us translate these principles into practical, meaningful support for families. Routines-based early intervention focuses on three key areas of development that matter most in a child's daily life. Engagement, the child's ability to be connected, interested, and actively involved in the activities and people around them. Their independence, the child's ability to participate and complete parts of routines with decreasing levels of adult support. And social relationships, the foundation for communication, emotional development, and trust. And by strengthening these areas across everyday routines like meals and playtime, getting dressed, and going out into the community, we help each child become a confident and capable participant in their own daily life. Everything we do, from coaching families to planning interventions, is designed to support growth in these three functional areas. To individualize support for each child and family, we need a clear picture of what their daily life actually looks like. To do this, we use the routines-based interview, often heard of as the RBI. It's a collaborative conversation that helps families walk us through a typical day from morning to bedtime. Over the course of about an hour, we learn which routines go smoothly, which are challenging, what the families value, and where meaningful opportunities for support can naturally occur. We also listen for the why behind routines. What brings joy? What causes stress? And what changes the family hope to see? This process gives us a detailed view of the child's participation, relationships, and learning opportunities within their real-life contexts. The RBI forms the foundation for a truly functional IFSP, one built around what matters most to the family and the goals that will make daily life easier and more enjoyable for the whole family. We know that children don't live alone in a vacuum, and that when a family is affected in one way or another, that also affects the child. So to truly support a child's development, we have to look beyond the child to the people, the relationships, and the systems that shape the family's daily life. We use the family ecological approach, which is where we explore the full picture of supports and connections around their family by looking at who they have for trusted friends, neighbors and extended family, community connections like childcare or parent groups or faith affiliations, and professionals and service systems involved with their family. Learning about these layers of support helps us see where families feel strong, where they may feel stretched, and where additional coordination or resources could help. By understanding the family's daily life and their network, we can design an IFSP and outcomes and interventions that truly fit their real life, strengthening not just the child, but the entire family system. Neuroscience shows that young children learn through repeated interactions and meaningful engagement with trusted adults, not during brief, isolated therapy sessions. The everyday routines families already do, like mealtime, dressing, playing, provide the greatest opportunities for practice and connection. Our role is to help families use these naturally occurring moments to support development, creating the intensity and the consistency that young children need to make developmental gains, which lead to measurable change. Because caregivers are with their child throughout the day, they're uniquely positioned to create meaningful learning opportunities. Embedded intervention means we work within the family's existing routines and help them integrate simple, effective, evidence-based strategies into what they're already doing. When children successfully participate in these routines, communicating, engaging, meeting expectation, developmental progress becomes both functional and sustainable. In early intervention, intervention strategies are the specific research-supported methods we teach families, such as modeling, prompting, and reinforcement. Coaching strategies are how we help caregivers learn to use those methods in real life. The intervention strategies are the what, and coaching is the how. Both are essential for supporting meaningful, consistent learning. Since our role is to help caregivers use these intervention strategies effectively during their daily life, we use coaching strategies to incorporate adult learning principles. During every session, we use observation, joint planning, guided practice, reflection, and feedback to build caregivers' confidence and independence. Over time, families begin to adapt strategies across routines, and developmental support becomes part of their everyday life. For some children, particularly toddlers with early signs of autism or social communication differences, we also use the parent-implemented Early Start Denver model. This is a coaching-based approach tailored specifically to support social engagement and early learning. It's still grounded in the same coaching framework, but the strategies are tailored specifically for supporting social communication, engagement, and early learning. And because we work with the whole child and the whole family, we also help caregivers navigate the broader system when needed. That includes supporting families in applying for Katie Beckett, connecting with outside case management, and linking to community-based programs like Roots or other appropriate services. One thing I really want to clarify today is how early intervention handles services across different disciplines, because this is an area where we often see some confusion on referral forms when they come in asking for speech and OT, for example. In early intervention, none of our work happens in isolation. We are a truly team-based system. Here in Maine, we have service coordinators, social workers, nutritionists, OTs, PTs, speech pathologists, early childhood special educators, teachers of the deaf, and teachers of the visually impaired. In early intervention, every family has access to the entire team, but that doesn't mean the child receives a separate OT, a separate PT, and a separate speech therapist like you might see in outpatient medical model services. Instead, we use what's called the primary service provider model. In this approach, the family has one main provider, the person who visits regularly, builds that relationship, and helps the family embed strategies into everyday routines. But that provider is never working alone. Behind them is our full transdisciplinary team. The child's team meets bi-weekly. In these meetings, we consult, we problem solve, and we make sure the child's needs across all developmental areas are being addressed in a coordinated, thoughtful way. I really want to stress this. This model is not watered down. It's not less therapy. It's actually a research-supported way of reducing duplication, preventing conflicting recommendations, and making things much less stressful for families. Instead of those providers giving 3 different plans, families get one consistent, coordinated plan that reflects the expertise of the whole team. So when you write a referral to us that says recommending speech and OT, we absolutely understand why you're identifying those concerns. But in early intervention, the way we address those needs is through the PSP model with the entire team behind that one trusted provider. Families are still benefiting from all of the disciplines. They're just receiving it in a much more coordinated, family-centered way. And again, this is all based on years of research and best practice. Just as we focus on building families' capacity, we also invest deeply in building the capacity of our providers. That ongoing professional learning is what keeps our practice reflective, coordinated, and grounded in strong evidence. It's what ensures that every provider across every site has the skills and confidence to support children and families effectively. All our providers, regardless of their discipline or whether they're staff or contracted, participate in specialized evidence-based trainings. These trainings strengthen both clinical expertise and understanding of family systems, which is essential in a routines-based model like ours. Each framework we use adds something different to our work and helps us tailor support to the unique needs of each family. For example, NBO helps us support parents' understanding of their baby's cues, which in turn supports responsive caregiving and secure attachment right from the start. Touchpoints, for example, prepares families for the predictable behavioral shifts that occur right before developmental leaps. These kinds of models deepen the quality of our intervention and help families feel more confident as their child grows. Collaboration between early intervention and medical providers is essential to ensuring that children receive comprehensive, coordinated care. When we work together, aligning developmental and medical information, sharing consistent recommendations, and supporting families with clear communication, we create a strong safety net around every child. One challenge we often face is around information sharing because early intervention operates under a different privacy law than healthcare systems. Medical providers, such as yourself, are governed by HIPAA, which protects health records, while early intervention falls under FERPA, the Family Educational Rights and Privacy Act, which protects educational records. Because of that, we can't share information using a HIPAA release. FERPA requires a separate education-specific consent from the parent or guardian before we can exchange records. To make communication smoother, we encourage medical providers to send a FERPA release along with their referral whenever possible. That one extra step helps us coordinate quickly, close the loop with medical providers efficiently, and save families from being the go-between. If your office doesn't already have our FERPA release, we're happy to send it, or you can download it directly from our website. Including that release from the start streamlines collaboration, strengthens communication, and helps families experience our systems as connected and not separate. Everything we've touched on so far, the principles, the teaming, the coaching, and the collaboration of early intervention all come together to support one shared goal, and that's helping families navigate the path to services with confidence and clarity. Our role is to walk alongside families as they learn about their child's development and diagnoses, discover their strengths, and build the skills and supports they need for the next steps. We want families to leave our program feeling empowered, knowing how to advocate for their child, support their child's development, growth, and learning, and carry those strategies forward into preschool and beyond. And what is so nice that's for us as professionals, whether we're in medicine, education, or social services, that shared commitment to helping children thrive is what connects all of our work. To wrap up, you can find all the information you need about our program and to make a referral on our Early Intervention for Me website or by using this QR code. Every referral you make helps us identify children early, and early really does make all the difference. Thank you so much for partnering with us to give every child in Maine the strongest start possible.